Welcome to Adapt NCLEX. Today, I want to talk to two people, those who are already in the middle of their studying, getting ready to take the exams, and those who are about to start. Um, Hear me out because I have a message for you. The keys to passing these exams is very important, and that may help you really well in your exams. So, let me show you something. Maybe you've never heard before, maybe you've never seen it before. But this is a strategy I think that will help you successfully passing the exams. So your board exams, they don't expect you to be an expert. Okay. Basically, the when you wrote those questions, the expectation of the exams is not for you to be an expert. They will just want you to be an entry level nurse. The exams is written in the form of an entry level nurse. And that is why they're moving towards the next generation, where they will give you a bunch of scenarios where you have to figure out um, which information is very important. And that is what an entry level nurse. You getting the basic information and then you analyze it to the point that you're able to fish out the most important information. And so bulk of your exams is all prioritization, as you can see. So bulk of your exams is all prioritization. Why? Because as an entry-level nurse, you need to learn how to prioritize information. You will be given so much information, but you need to prioritize it to your patient to be able to take care of that patient. And how do you do that? Is by knowing the disease process of which you're dealing with. And the reason why this is big, if you know the disease process, then you turn out to be an expert. But at the moment, they don't want you to be an expert. They want you to come in to the point that you'll be able to prioritize. And when you prioritize, you learn more about the disease process. And it goes the other way around. Your ability to prioritize is based on your ability to be able to identify the disease process. And if you identify the disease process, you'll be able to answer any next generation questions because it's a case form and you can see all the information they've given you. So this is associated with the disease process, this is not. So don't be an expert, just be an entry level nurse. And you do that by knowing the disease process of which you're dealing with. And that will give you the strength to prioritize and answer those questions. So, how do you do that? Well, the disease process is just basically the pathophysiology of the disease process. It's a big word. It means what is one or two words that you can say about a problem that you will let anybody, even a very somebody with a lower level, will be able to figure out that, oh, this is what you're talking about. If you're talking about hypertension, what one or two words you can say about that and take that one or two words and move it to any level of questioning and said, this is the underlying problem. And that is what pathophysiology is about. It's pathological and physiological. So, what is in their pathology, the body system, that is making you see the signs and symptoms? That is what pathophysiology means. The underlying problem in your body, organic structure that will lead to manifestation of a certain disease process. And that is what pathophysiology, physiological manifestation and the pathological manifestation. And that is what the entry level nurse need to know. Nothing more, nothing less. And therefore, when you're taking care of a DKA patient, you can go back and say, what is that pathology and how would it manifest itself? And so when you master that, you can prioritize better than anybody else. And then you'll be able to do something else. And that's the secret over there. The secret is when you've achieved that level and you are prioritizing, then you go in here. That how do you prioritize? Is by being sharp. And that is what an entry-level nurse should do. You're just looking for something that will kill the patient if you don't do anything. That will cause morbidity if you don't do anything. That will cause mortality if you don't do anything. You are being sharp, but you are not being an expert. We don't want you to be an expert, but we want you to be sharp. Have your antenna up so that when you see something wrong, you say, no, this is not right. If some patient says something wrong, you said, no, this is not right. When you see something physically presented to you, you said, no, this is not right. I need to intervene, I need to teach, and I need to find what is the underlying problem. And so the secret sauce over here, the question mark, as an entry-level nurse, is that after you have achieved that content, what do you use it for? Is to find the risk factor for that problem. And then with that risk factor, you'll be able to teach your patient and educate them about what they should look for if they see that problem to avoid that content level, that disease process. And then when you do something, you can intervene. So your content that you have achieved through pathophysiology will let you answer any risk factor question in the SATA, in the NCLEX, any teaching and education level in the NCLEX, any intervention level in the NCLEX. And guess what? This is what they put together as a select or apply question. So that's what they do with the select or apply question. It's basically nothing. It's a bunch of risk factors, a bunch of teaching, a bunch of education, a bunch of intervention. They already know that you know that as an entry level that you have achieved through your content, which came through the pathological, physiological finding of that disease process. And you jump all this and they collect it together and they give you a select or that apply. And it look like a bunch of questions, but they are basically what you already know. They want to see if they give you most of the things you know, all the risk factors you know, can you identify them? All the teaching that you know, can you identify them and can you intervene? And this go down like that. So if you already know the risk factors, you'll be able to teach the patient and educate them what they need to do. And if they do something wrong, then you can intervene. And that is exactly what they want you to do right there. So you see how this is interconnected, entry-level content, which is required for the board. And that will provide you the risk factors, the teaching, education. They form a SATA question, but they can also go down. And how do you answer the SATA question? Find the risk factors and see if you can intervene, teach the patient, and educate them. So those are the secret sauce for your NCLEX. That will help you answer the select or apply, which form bulk of your exams. So how do you solve those questions? The idea is to have a plan. And this is what I'm offering you. You may have a method, but I think this method will really help you. It's really, really help you because it keep you focused on what you look for in your exams, what to look for as you answer those questions. So they will give you a statement, and when they give you a statement, you have to analyze it. What you do is go for the acts. They will tell you should intervene, what are the risk factors, what kind of teaching, which is all coming from your content. So and that information can be obtained from the last portion of the question. Then you look at a case, the rest of the question that will tell you the scenario where the patient is located, what is exactly happening. And out of that, they will give you some keywords. This is the same as the keywords, which is the buzzwords. I call it the buzzwords because they should be buzzing in your ear. If you hear something that, oh, This is you hear somebody is wheezing, you hear somebody who is drilling, if you hear somebody who is grunting, if you hear hypotension, you say, that is not normal. I need to do something about it. Then you put those buzzwords. Usually I try to get 3 to 4 buzzwords, and you rewrite the question, making you take control of that question. And out of that rewrite is what you take to each 5. If they give you 5 questions, what you do is you analyze each question. Just you start from the top, analyze each question based on the buzzwords, whether it satisfies all the buzzwords, and then you make a decision. You pick an answer and you move on. Your choice you want to pick is what you've selected, and then you move on. Don't overguess yourself. Don't overthink of yourself. Just move on. So your ask, your case, your buzzwords, your rewrite, your choice, and you move on. And that is the key, the secret sauce for SATA Select that or that apply. And then remember, when you achieve the entry level, there's a question mark there. What does it make you? It makes you very sharp. They don't want you to be an expert, but they want you to be what? Sharp, so that you can figure out something is wrong. So being sharp, it means you have achieved an entry level content, not an expert, just an entry level content, so that you can answer the question appropriately if they offer to you and you see something that is abnormal. So an entry level content based on the pathophysiology will give you the idea to be sharp. And that is my method of prioritization. You saw the SATA. Now for the prioritization, this is how you approach prioritization question. Is B sharp? The B is a breathing problem. These are the things that always cause patient morbidity. There's so many things that cause them, but these are the ones if you don't do anything, they're going to have problems. So I put them together in the form that you said these are the conditions that I need to worry about. Look at them the second time. So breathing, so this is breathing, that's the breathing. So there's certain things that cause breathing. So anything that affects the lung itself. And as you can see, I draw it like that. Lung, like if you have pulmonary embolism or if you have pulmonary edema, all this thing can cause problem. Okay, if you have a pneumothorax, it can cause the lung not to breathe well. And that is something that you have to worry about. Even if you have a DVT turns into PE, and then that also causes a breathing problem. So there's few things that are over there that you should be worrying about. Then the E is the electrolyte. So few electrolytes that control your body homeostasis. So your calcium, your magnesium, potassium, and sodium. When these levels are low and high, you should be very careful that they're going to cause a problem. And so when you see those answer choice, look at it twice. I give you a calcium of 17. That's really, really high. Calcium of 6. That's really, really low. And the patient will tell you, I'm not feeling well, through their physical exams. That's all what this is, being sharp, is about. And the S is sepsis, okay? Sepsis and shock. They look alike. Basically, sepsis is infection, but it's a severe form infection. Patient temperature can be low or high. And then they may have blood pressure will be down. So hypotensive and tachycardia. Those are the key words you're looking for. They give you a temperature, they give you blood pressure low, and then heart rate high. You should be thinking about sepsis. Or somebody just had surgery and the wound doesn't look fine. That is sepsis. You got to intervene. And then the S, which is the shock. Shock is the same thing. They have blood pressure problem, very low, heart rate high, and their mental status will change because it's hypoperfusion problem. They are not getting blood into their brain. So, and the thinking is affected. The whole body system is affected. So it's a bleeding problem, a bleeding, which is shock. Any person that they give you a question that is bleeding, you should be worrying about. Then this one is hypothermia. That's the H. Okay. So we're talking about temperature that is low, like 97, 96, 96, okay, Fahrenheit. That one is not good because hypothermia is usually, I consider that as a cardiac problem. So 96, you get cardiac arrhythmia. Okay, so those things are not normal. Okay, that those things are not normal, so you should be thinking about it. And hypoglycemia, they like tricking you with this. They will give you a sugar of 500. Don't worry about it. Sugar 300. I'm not worrying about it. Unless your sugar is less than 70, I'm not I'm not worrying about you, because when your sugar is low in the 60s, your brain function cannot work. The whole body system is affected. You become lethargic, you become confused, and your whole body basically in a hyperdynamic state in order to get all the energy that they need. So that's what you're looking. You're just being sharp as an entry level nurse. And then this, you see, it doesn't have the lung there. This is your number one, and that is the airway. Anything that is affecting this pipe, you have to be sharp about it. So if the patient has a stridor, yes. If they're drooling, yes. You see, if there's like tracheal deviation, anything they give you, there's a bronchial something, they mention bronchioles, they mention trachea, they mention larynx. I mean, you just basically trying to be supraglottic, something, whatever they say that is associated with this tube, I have to pick it as my number one, no matter what, because it's the tube that is bringing oxygen into the lung. So you have to pay attention, and that is number one. And of course, the R is lethargy. That's a neurological problem. So when you're lethargic, your brain doesn't function well. And when your brain doesn't function well, it affects your breathing system, because that's where your breathing is located. It can also affect your circulatory system. So this is why a neurologic problem is very important. So they become lethargic. They will have acute mental state change. So anybody in your test that they give you and is confused, you have to worry about it. Confusion is always a problem. You got to figure out why they're confusing. Is it because they have electrolyte problem or they have neurological problem? So you got to figure out. Any patient who had a seizure, yes, is a problem that I should worry about because of the airway issue. And even they can give you restlessness in over here in airway. I forget about it. Restless. You cannot take this as anxiety. They give you restless. It's either they have an airway issue or some form of breathing issue, but mostly airway. And you should consider it as very, very serious problem. Okay. So that's all the information you need to know about being lethargic. When they give you a patient who's lethargic, he just have acute mental status change, just had a seizure, look at them twice. And my favorite is pain. Okay, we all have pain, and pain is always a trick thing they give you in your exams. Every patient that come in may have a sort of pain, but you have to figure out which pain you have to be sharp about. Which pain, as an entry level nurse, can you weed out? And you said, no, this is the one I need to be sharp, extra careful. And the way to know about it is the pain that is going to affect the individual life, their lung, and their eyesight. So if you have a pain in your eyes, and I know this kind of pain can make you lose your eyes, I'm choosing you as a priority action. If you have a pain in your leg, and I know you can lose your leg, I'm choosing you. If you have a pain that I know if I don't do anything about it, you're going to die or you're going to lose an organ, I'm choosing you. And that is the pain for that will cause you to lose your limb, life, and the eyesight. And that is the key. That means you're critically thinking, you're using yourself as an entry level nurse, and you are being sharp. You see how it's connected? This is the critical thinking right here. That I'm being sharp, I'm critically thinking, and as an entry level nurse, I'm prioritizing adequately using this technique. And as you can see, these are a bunch of words put together with disease process that is very common. It has very high morbidity, high mortality, and I have to be extra careful. It's a toolbox, basically, that you carry with you, like your Bible, and you take it with you and say, this verse, I've seen it before. I've seen DVT is a breathing problem, and I need to apply it to be able to take care of my patient. You are just being extra careful. You are just being focused. Remember, every patient is a priority. If they give you 4 patients, all of them is a priority. That is why they came to the emergency room. They came there because they have a problem. To them, they have a priority problem. But you, as an entry-level nurse, is to be sharp and see which one I need to take care of first. All they asking you, take care of one patient at a time. But who do you want to choose? 4 patients, who do you think deserve the first position? How do you do that as an entry-level nurse? Is to be sharp. And being sharp is take care of the breathing issue, take care of electrolyte issue, take care of sepsis and shock, take care of hypothermia, hypoglycemia, take care of the airway, take care of a neurological problem, and take care of pain. But how do you do that? Classify them here. You may get airway, lethargy, pain, and sepsis patient, but then you got to go to the second level of thinking. That is where the advanced level come in. But as you know, based on the disease process, you know which one can kill the patient first. If I have an airway issue, neurological issue, and a pain issue and a shock, I'm choosing an airway. If there's no oxygen coming in, you're dead. I can give somebody blood to help with the shock, or sepsis, give them antibiotic, pain, take care of the pain. But this one, I don't have time, minimum time. Do you have time to do something else? Yes. And therefore, that's why I would choose this. If I have a breathing issue and a circulatory and a shock, I'm choosing a breathing issue because it's still the lung. I know we always say ABC, I hate ABCD, whatever it is, because it does not let you be sharp. It doesn't let you think. We want you to think as an entry level nurse so that you can prioritize. So this is the key for entry level nurse who is trying to take your NCLEX. So let me use an example of a peripheral vascular disease, and you will see. Peripheral vascular disease is basically is part of the arterial system where the individual, so if this is your heart, okay, your heart has vessels that come out, the aorta come out, receive blood from the left ventricle, and it come out, this the chest, this is the thoracic, aorta coming, it crosses over from the diaphragm, then get to your abdomen, then you go down, and this is your pelvis. It crosses over and you go down to your leg. Okay. And they supply your leg. Anything of PVD, PAD is dealing with an arterial problem. PVD is a venous problem. Then you ask yourself, what is the PAD? It's an arterial problem. So basically, you having the artery is no more functioning the way it's supposed to. Blood flow doesn't go the way it's supposed to. So there's risk factors of other things that will cause you to have peripheral artery disease. Okay. And they want you to know that, like, something has caused the blood flow into my leg to decrease. So there's few things that can do that, right? You can have hypertension. And how does it do that? It's because of the increased systemic vascular resistance. There's too much pressure that it damages the vessel. So it damages the vessel. The next one is smoking. Okay, when you smoking, nicotine is a vasoconstriction. Okay, and that also make the artery really tight and it decreases blood flow. Then people who have diabetes, okay, the sugar, glucose, causes damage, inflammatory damage. So inflammation of the artery and make it thicken. And the next people, if you have cholesterol, so lipid, if you have too much cholesterol in your blood, it forms plaques and block it. Okay. And if you order, yes, your vessels get thickened. Guess what I've done? All this thing, what did they do? It block the vessel and they form peripheral artery disease. These are your risk factors. This is what they put as a select or apply. This is a risk factor. You see, it's just asking you some of the things that you know will cause it. So for people who have plaques, you have this yellow stuff there, blood flow is not there. If you have um, diabetes, this is so thickened, it has a lot of calcium, okay? If you have hypertension, the same thing. So that blood flow going down is decreased. Therefore, this person is not getting the amount of blood that he's supposed to get. And therefore, what do you think? My blood flow is decreased. Okay, blood flow is decreased. Well, if you walk, you get pain in your calf. Why? It's a demand ischemia. I'm asking for blood and I'm not getting blood. Therefore, tissue is dying. Okay. The tissue is dying. So it's demand. I'm demanding blood. I'm not getting it. Then I get ischemia. This is the same thing as somebody having a heart attack. So when you're walking and you're getting pain in your calf because of peripheral artery disease, yes, it become what? Ischemia. And that is what causes the claudication. So this is what they complain about. It's called claudication. It's just an ischemia. Okay. And what will happen? Well, at rest, because you're not asking for demand, pain get better. Because they're not demanding anything, the pain get better. What are you supposed to see? Like I told you, as an entry-level nurse, when you know your risk factor, you can ask for signs and symptoms based on the pathophysiology that you know. If there's less blood going to my leg, okay, blood going here is now decreased. I don't have enough blood going there. Well, I'm in trouble. Okay, I don't have enough blood going there. All this is blocked. It become a problem. Okay, I don't have enough blood going there. This is like become a problem. You're not getting enough blood going here. And so what will the patient will complain about certain things? Think about it. Okay. No blood. When they walk, they get pain. What do you think the leg is going to look like? It will be shiny, okay? And then atrophic because tissue is dying. They're not getting enough blood tissue. Blood to flow over there. If you check their capillary refill, it will be longer. So it's greater than 2 seconds, right? So it's greater than 2 seconds. And that's what happened. If they have a wound there, it's not going to heal. So prolonged no healing of their wound because the blood flow is decreased. Blood is usually warmed. And if there's no blood there, their feet is going to get cold, right? Like you said, the skin will be what? Shiny, and their nail will be thickened because of lack of blood, and it became atrophic also. Thickening is trying to get blood as much as possible. You expect your pulses, like I told you, and with the cap refill to decrease. It's not going to be normal. And this is what happened to them. If they put their leg on the floor, blood will flow with gravity, and therefore dangling their feet is much better. Okay. But if they elevate their leg, blood will decrease because it can't flow with gravity anymore. And therefore, pain get worse when you elevate their leg. This is what I've done. I'll give you select or apply using pathophysiology, coming down with the risk factors and what is expected. This is what entry-level nurse is supposed to be doing. Therefore, you can teach them, okay? You can teach them based on your risk factors. Well, how would I teach them? Okay, I can teach them what to do. Stop smoking, okay? So that we can stop this. Walk more, okay? Right. Control your glucose. Control your cholesterol. Right? Control your blood pressure. You've done your teaching right away. What else? If you lift your leg up, it's going to hurt. I want you to dangle your feet. If it's hurting, don't elevate it. Okay? And look at your feet all the time, because so that you can avoid injury. If there's injury there, it's not going to heal. I don't want any injury as much as possible. And this is what you've done. You've teach them. And so when they say something wrong, you intervene. So this is how you can use the information as the entry level nurse and to answer the question. Then let's look at the vein. You ask yourself, what is the pathophysiology of venous system? Well, vein follow the same pattern of the arterial system. So this is the vein. Okay, it does one thing. It returns blood to the heart, and it has valves there. Blood go in one direction from the leg up. Unfortunately, sometimes the vein become incompetent and the valve turn like that. And so blood a little bit go there, but some of them return back because of the reflux. So this is the reflux. And that is all. I've done the patho and the physiological patho aspect of the problem, and we can figure out the physiologic aspect of it. What would I see based on that? Okay, what would I see? First of all, what is the risk factors? Basically, now we want to prevent blood from staying here. The vein want to send blood. And so if I let blood stay here for a long time, it's going to reflux. So what is the risk factors? Where somebody with prolonged standing, like some of the nurses can develop this because they stand throughout the day. That's why nowadays you have a very long socks to help with that. So it's a compression stocking, right? And so those are the risk factors. Somebody who have a DVT will cause the vein to become incompetent, right? And so that puts you in this condition. Or pregnancy. Pregnancy is another risk factors. Or patient who on oral contraception, birth control will let you develop DVT, and will do that. It will make the vein incompetent. What do you expect? Symptoms. If blood is staying there for a long time, it doesn't go, it's different from the peripheral artery disease. Blood doesn't go into their leg, so their leg is what? Cold. These people is going to be warm. It's opposite, bi-directional thinking. If I know what is going to happen to the artery, I'll just change it into the venous system and I can answer any question. So their feet is going to get warm. If blood stay in your leg for a long time, well, the pigment in the blood get deposited on your leg. And that's why they see pigmentation. They see pigmentation on your feet, the feet. And if you have a lot of blood sitting there, it's edema. So the skin is hard. It's no more atrophic and thick, right? And they too, they can have ulcers because of the blood that erodes. I mean, it stayed there for a long time and then it causes erosion. Basically, the subcutaneous area become thickened and any small skin breakdown become a problem and they get ulcers. I've basically given you everything that you know. Therefore, how will you treat it? We know the problem. We go back to the pathology. This is our physiology. We've done our physiology here. This is what I see. Now, to fix the physiology, go back to the pathology. That is the idea. So, this is our pathology. This is our physiology. Go back to the pathology to fix it. How do you fix it? Well, get rid of the blood that is staying there. So, avoid prolonged standing. Wear compression stockings to help with that. If I need to retain the blood, I shouldn't be in the dependent position. So elevate the leg, which is opposite from the arterial one. If you are in dependent position, it's bad. So avoid dependent position. And that's all. You can also tell them to exercise to retain the blood, okay? And avoid long travel. And of course, no birth control if you have to, and then prolonged standing is avoided. And this is all you need to know. I've done a full lecture on peripheral vascular disease using the pathology and then the physiology. So this is the pathology. This is the physiology, is what you see. Okay? And that's what I mean by entry-level nurse. So let's see as an entry-level nurse what we can use, what we've learned to see what we can apply. Answering questions is a priority questions is underlined. So we find our acts. Which statement require a priority intervention? Okay. A client with a known peripheral vascular artery disease present to the vascular clinic for evaluation. What is being asked? Priority. So that's our acts. What is the case? Patient has a PV peripheral artery disease. Basically, PAD basically came in with that, and we evaluate them. So buzzwords is the same thing. Acts being peripheral artery disease and priority. So I have somebody who has peripheral artery disease. What should be my priority intervention? Then you have to say to yourself, what is peripheral artery disease? Less blood flow, and therefore I'm going to use that information to answer each question. That's the entry-level content. Less blood flow. I'm using less blood flow to analyze this question. My leg hurts, so it hurts more when elevated. Does that make sense? Like that makes sense. If I elevate my leg, it hurts more when I elevate it, which should make sense because if you elevate it, it's going to be more painful because there's less blood flow, right? So it doesn't require intervention. The patient knows that when they elevate it, it's going to hurt more. So I don't need to intervene. I don't need to be sharp about this. I will keep my feet below the level of the heart when painful. Yes, if it's hurting, dangle it so that more blood will flow. I don't need to intervene. I will look for ulcers on my great toe. Yes, they have ulcers, so I have to look for it. This one, my leg now hurts more at rest. Guess what? When the patient is dangling the feet, that's when it's hurting more. You see how you got to be the ringing bell. This should be ringing in your ear. That's the buzzwords. I need to intervene. I'm having pain. Okay. What kind of pain? Pain is at rest. The patient shouldn't be having pain at rest. They should be having pain when they elevate their leg. If I have pain at rest, that means I'm getting ischemia. Blood flow is now low when my leg is on the floor. Blood flow is supposed to be better when my leg is on the floor. If it's now low when my leg is elevated, I need to be sharp. That is an ischemia. This is a ischemic type of pain. and ischemic type of pain, the patient is going to lose the alarm if there's no more blood flow. Therefore, this is pain, the P aspect of the B sharp. I need to intervene. Entry levelness, C, I need to intervene using that idea. You don't have to be a specialist, but you know that you have to be sharp. And the P is pain that is going to cause the patient to lose their limb. They're supposed to have pain when they elevate the leg. Now you put your leg down and you have pain, extra careful. Look at it again. So this is the answer. Priority intervention. And that's the priority issue. This is a tricky one. I know, but the more you practice, the more you get used to it.